Hello, in this video, I'm going to talk about diuretics and how they work physiologically in the body. So a diuretic in general is any substance that increases fluid loss through increased urination. So there are lots of different mechanisms through which diuretics affect how the kidneys process, filtrate, and how they retain water or get rid of water. So a diuretic is any substance that would cause the kidneys to lose more water, which would make a greater quantity of more dilute urine. So I'm going to give you a very brief overview of a nephron here, just for context as we talk about diuretics. But I also have a separate video where I go into more detail about nephrons. So that video is linked in the description below. So a nephron is a functional unit of the kidney. So a nephron is basically what is filtering the blood and creating urine. So it's what is filtered out of the blood to go into the urine to be excreted from the body. So blood flows into the glomerulus. That is this tangled little ball of capillaries. So blood flows from the arteries into this tangled ball of capillaries. And from there, some of the fluid in the blood is pushed through the blood vessel wall. It comes out, and then we call it filtrate. And that filtrate, that fluid, then goes through this whole system of tubules. While that fluid is going through this whole system of tubules, some things are secreted into the fluid. So there are these other blood vessels that will secrete bad stuff, toxins and things that we want to get rid of, will be secreted into the tube so that it goes out with the urine. And other things that we want to keep from that fluid will be reabsorbed out of that fluid and back out and into these capillaries so that it's carried away in the blood. Okay, so a lot of fluid is leaving the blood supply and going through here, and we need to reabsorb most of it. Otherwise, we would just be getting rid of all of the body's water and you can't survive. If we didn't reabsorb most of it, we would die pretty quickly of dehydration because we would lose so much water. Okay, so that's what's happening in the nephron. So we are getting rid of bad stuff that's going out through the urine, and we are reabsorbing the good stuff that we want to keep. So the water, variety of different electrolytes, and other things that we want to keep. Whatever remains at the end is going to go out through this collecting duct and becomes urine. So it goes out through this collecting duct, and those ducts get larger and larger and larger until eventually they exit the kidney through the ureter, which travels and brings that urine down to be stored in the bladder. So that's kind of the short summary version. But if you need more detail, please watch my separate video about that. All right, so the way caffeine acts as a diuretic is that it increases glomerular filtration rate. So glomerular filtration rate is the rate at which that filtrate is formed. So it's regulated by the blood pressure of the blood coming through the afferent arteriole. Okay, so we have an afferent arteriole, meaning the arteriole or the blood vessel that's going towards the glomerulus. And the efferent arteriole is the blood vessel that is exiting and going away from the glomerulus. Okay, so we regulate how fast that filtration is happening by regulating the blood pressure in that vessel leading in. Okay, so if we have higher blood pressure in that vessel, that's going to cause faster glomerular filtration rate. If we have lower blood pressure there, then it's going to cause slower glomerular filtration rate. Now, generally, we keep it consistent. We keep the GFR consistent overall by dilating and constricting that blood vessel to regulate how much pressure is being placed there. So even when we're exercising or doing whatever we're doing and our blood pressure is fluctuating throughout the day, our GFR should remain pretty consistent because we manage that pressure in that vessel by allowing it to dilate and constrict. So with caffeine, it increases the GFR because it opposes the vasoconstriction of that vessel. So it opposes the ability of that vessel to manage the pressure that's coming through. So it opposes the vasoconstriction. It allows it to just be dilated so that a large quantity of blood comes through, and that increases the rate at which that filtrate is formed. So it's increasing GFR. So higher GFR means more filtrate is coming through at a faster rate, which means that there's less time to have that reabsorption of all the water and solutes and things that we want to reabsorb. The faster the filtrate is moving through our system of tubules, the less time there is for the whole process of secretion and reabsorption to take place. So faster GFR means we're going to lose more water and solutes because there isn't time to reabsorb them. And then caffeine also has the effect of inhibiting sodium reabsorption in the proximal convoluted tubules. So that's this part of the tubule. So the first part after the filtrate is formed, normally we would have some sodium reabsorption back into the bloodstream, and it inhibits that. So when we lose sodium, we also are going to lose more water because of our need to maintain our electrolyte balance. Okay, alcohol also is a diuretic, but it has a completely different mechanism. So it inhibits the secretion of antidiuretic hormone, which is also called vasopressin. It's the same hormone. An antidiuretic hormone's job is to tell the kidneys, it tells the loop of Henle especially, so this nephron loop of Henle, it makes it able to absorb that water. We want to reabsorb the water from inside the tubule back into our bloodstream so that we're not losing all of that water. So antidiuretic, meaning it causes us to keep our water. So if we don't have enough antidiuretic hormone in circulation, then we don't have the ability to reabsorb water as that filtrate is moving through our system of tubules. So not having ADH means we're going to lose a large volume of water. And that's why if somebody is having a night of drinking, and then they have to start peeing a lot, you urinate a lot if you're drinking alcohol. And it's not just that you're urinating the drinks that you're drinking, it's that you're losing your body's water because you have suppressed your antidiuretic hormone. So the more alcohol in the body, the less ADH. So as the alcohol leaves the system, ADH increases, and as alcohol goes up again in the system, ADH decreases. And that's also why having a lot of alcohol will cause a hangover really commonly the next day. It's really dehydration. It's because no matter how much water you're drinking while you're drinking alcohol, you're not retaining it because you don't have the ADH to do that. So the trick is to increase water intake as the alcohol leaves the body so that you can start to retain that water to avoid the extreme dehydration that you experience the next day, which is what the hangover is. Okay, then there are also diuretic medications that are usually used to treat high blood pressure. So there's 3 different classes that have different effects on how the nephron is functioning. So the first class of medications is thiazide. That includes many different medications under that category. So it acts by blocking sodium and chloride channels in the distal convoluted tubules, so the far end of the system of tubules. And it also inhibits reabsorption of sodium and water. Now, importantly, it does interfere with potassium. So somebody on thiazide types of diuretic medications would be at risk of having low potassium. So very often this person on this type of medication would be put on potassium supplements. These are the most commonly prescribed diuretics. So this is often the first line of treatment medicinally, pharmaceutically, in terms of trying to lower blood pressure. And it decreases fluids and also has the effect of relaxing blood vessels, which is why it can be very helpful in reducing blood pressure. Then the second class of diuretic medications is a loop type. So these reduce sodium and water reabsorption in the loop of Henle. So I mentioned that in our discussion of ADH, but ADH causes the loop of Henle, or the nephron loop, to reabsorb water. So loop diuretics will minimize it. It doesn't completely stop the reabsorption of water, or that would be fatal in and of itself, but it reduces it. And so this type of medication is often used to treat heart failure, where you're trying to get rid of a good volume of fluid. But again, it also does interfere with potassium, so that is still a danger in this case. Then potassium sparing diuretic medications work very similarly to thiazide, but with the specific difference that it doesn't affect potassium. Now you may think, well, why bother with the first two classes if you can take one that spares potassium? And that's because it's just not as effective at reducing blood pressure as the other two. But it is available for people who are at higher risk of low potassium, or who are having difficulty with absorbing or consuming enough potassium, or for whatever reason are at higher risk. Then there's potassium sparing diuretics. All right, thank you so much for watching. Have a great day.